Good morning, sleepyheads. Very good. Guys, I got a brown shirt.
That's a
Wow,
nice brown
I
shirt.
wonder where he got it.
Guys, today is a big day for me.
I ain't no sleepyhead. Hello, everyone. My name is Dr. Bone, and I'm a licensed dentist. Today, I'll be critiquing Mr. Ryan Trahan's journey in relation to wisdom teeth removal and wisdom teeth recovery. Stay tuned because this is going to be a very interesting one.
In my life. I mean, you only have a day like this once. Hopefully. I'm getting my wisdom teeth removed today, and I'm nervous. I've never had surgery. I've never done anything to alter my sobriety. Haley has already agreed to take care of me for the next few days. Wife. She's my wifey. However, the rule is that I can't eat or drink anything 8 hours prior to this surgery, which made me realize how much I love eating and drinking things. I actually look forward to it every day. So I'm just gonna do my
So if he was instructed to not eat or drink anything prior to surgery, this is most of the time is not related actually to the removal of the wisdom tooth itself, but rather it could be instructions given as to, I'm guessing he's going to have some form of general anesthesia or sedation. And one of the main reasons that they do this is because the patient may be in a vulnerable position, in a sense where they don't want anything to block the airway or the throat.
normal montage of making coffee, except nothing's gonna come out of it. Sad. Ugh, I love coffee.
I love coffee too.
I'm gonna get ready to go. I'm wearing taking care of me. It's Haley.
I was hired off Craigslist.
I have a cavity on one of my wisdom
So she's like a driver hired from Craigslist.
teeth, which is one of the main reasons I'm doing it. It's really gross.
Didn't they say there was like food stuck in
No,
it?
Haley, it wasn't. It wasn't the case. All right.
So I heard he's saying that he has a cavity or foot stuck about his wisdom tooth. Well, actually, there's something called as indications of wisdom tooth removal. Not every single wisdom tooth must be removed, but if you have problems, i.e. dental caries, cavities, pain in relation to your wisdom tooth, then most of the time it is indicated for removal. Of course, after thorough assessment and x-rays and so forth.
I'll see you inside.
Your tongue, everything. You're gonna leave.
What's up, secret channel? First time ever having a surgery.
So as you can see, they already put like some tubes into his nose, and they're measuring his vitals on his arm. Looks like he's going to have his wisdom teeth removal with the assistance of sedation as an anesthesia or a general anesthetic. We're going to see what they will do. They put an eyewear to protect his eyes from any blood splash or anything to fall into his eyeball. They also put a head cap for two reasons. One, so that nothing come on his hair, but also so that nothing from the hair itself would fall into the surgery side to maintain sort of like a sterile, clean area for the operation side.
I'm gonna see how long I can go without falling asleep.
Oh my god, okay. So what you saw is an animation of wisdom teeth removal, however, using a surgical approach of sectioning. Sectioning means they would separate, it's like separation of your wisdom teeth. A separation of the crown from the roots, also the separation, cutting of the crown itself, and the separation of the roots. It looks like he just had his wisdom teeth removal and he can barely walk. Oh my god.
There you go. Put one foot in. Other one in. Watch your head.
Oh, buddy.
You did great.
Thank
you
you.
guys. Have a good one.
You too.
So as you can see, there's a lot of that white stuff in his mouth that's mixed with blood. That is called gauze, and the gauze they put it in your mouth to press on the wound following removal of any tooth, not only wisdom teeth. He did say that he had all four wisdom teeth removal at the same time. And this is actually not a horrible thing. You could, now granted that he actually needed to remove all of these wisdom teeth. Also, because he had a bit more aggressive form of anesthesia, like sedation, not a local anesthesia with needle, then I guess he opted to remove all of them at the same time, so he doesn't have repeated episodes of that sedation and anesthesia going into his body. The role of that goes the white stuff I said about and pressing on the wound to help with the control of the bleeding following wisdom teeth removal.
Hi, buddy. Huh? Can't understand a single thing. In and out.
Yeah, so he's saying boom, in and out, like procedure was quick, I assume, although quite extensive. I mean, removal of all four wisdom teeth. For to provide some context, naturally, you may have up to four wisdom teeth. You could have less, right? Because there's now somebody in the comment section, and I know these are the only people that comment will come and say, but my granny only had one wisdom tooth and she did fine until age 170. That's fine, Oscar. But what you need to know is it's normal to have some of the wisdom teeth erupt, meaning one or two or three or even all of them. Or it's fine if you had none of the wisdom teeth erupted, but I would say better to have an X-ray, again, not medical advice, just to check because they could be there, but they just did not come out. Yeah, so you could have some, you could have none, and you could have one or two or a few.
You don't remember a thing? You want food?
So he does not remember anything. Again, this looks like he had a bit more sensitive anesthesia, like sedation or.
Smoothie? Maybe. Can't understand. Yeah, it's so fast. You doing a hug? Okay. Have a hug.
So obviously it's a bit exaggerated because he's a YouTuber and so forth. Normally it's not that bad, but I would definitely say that having all four removed at the same time is a bit of a tiring and really fatiguing process.
That's why I can't understand you. He'll get you.
Okay.
My lip feels swollen.
It's normal size.
Really?
Yeah, you just can't feel it.
So he says his lips feel swollen, or they wouldn't be actually swollen. As you can see, there are no signs of a
Really?
swollen lip. However, he gets that feeling because also with a lot of our surgeons and then doing in addition to the sedation, which is like the tubes they put and that anesthesia that they did, they would supplement it with a local anesthesia. So why is this? Why is this? Because not only like it's not primarily for pain control, but the anesthesia itself, it has a component that's called adrenaline. Adrenaline also will help to make the anesthesia more potent and, to my knowledge, to last longer because lasting long is important. And also it will help, and most importantly, in bleeding control. And how does it do this? Well, because adrenaline is a vasoconstrictor.
Yeah, you just can't feel it.
Vasoconstrictor means you have your blood vessel, right, which looks like somewhat of a tube. A vasoconstrictor constricts a bit that tube, okay? Hence helps in limiting or reduction of the bleeding in the extraction side. Whereas in opposite, it's called a vasodilator. A vasodilator will help dilate or open up that tube. An example of a vasodilator that you may have heard of is nitric oxide.
Spilling all over.
To go back to the feeling of swollen lips, again, as I said, you may use a supplementary local anesthesia. For the lower, it's called inferior alveolar nerve block. Why? Because the nerve that they're blocking or anesthetizing is called inferior alveolar nerve. Why is this relevant or important? Well, because that nerve extend to supply this region inclusive of the lip and the sensation on your chin. So when you kind of lose that sensation, or when it affects that sensation, you're going to feel a bubbly feeling or a bit of swollen lips in that area until the anesthesia wears off. How long until the anesthesia wears off? Well, depends what type of anesthetic was used. We have a long acting anesthetic, we have a intermediate, and we have a short acting anesthetic.
Burp. It's all over. Too fast, Bella, too fast.
So you may be wondering, well, why don't he just use a straw and to help consume that smoothie much easier, right? Well, wrong. You should not use a straw following any tooth removal, not only wisdom teeth removal, because you will be at higher risk for an extremely painful condition that's called dry socket. Why is that? Because the sucking motion when using a straw may dislodge something called as a blood clot that comes to fill in the extraction socket or site. When you're using like a straw, or when you're spitting, or when you're rinsing, you may dislodge that blood clot. Well, what do we have now? We have a sort of somewhat of an empty, of course I'm simplifying things just to make a point, and somewhat of an empty, or rather a bit of a dry extraction socket, and hence the term dry socket. The scientific term is alveolar osteitis.
What's up, guys? I had my surgery.
Alveolar in relation to the alveolar bone which supports your tooth. Osteitis, osteum or osteo, like that term is in relation to the bone, right? If you ever heard of, just an example, osteoporosis. Why is that? Because it's a problem in relation to bone. And itis in a sense of like an inflammation or reaction in that region.
Evil laugh?
Yeah, he got me smoothies.
You already chugged almost all your large smoothie.
Yay!
So why smoothies? Because it's advised following wisdom tooth removal in relation to diet to help with recovery is to have a soft diet, because you will not be able to chew, and it's not actually advised to like chew on hard or difficult to eat or chew foods, right? So it's better to have things in the form of a smoothie, or not only a smoothie but really soft diet following wisdom teeth removal. And as we address, to avoid or not only avoid but to not use a straw following any tooth removal.
I got a secret here. Wise men say, only fools rush in, but I help flying in. I can't feel nothing. I feel like alligator with a big snout. Please tell me, I am still me too.
Yeah.
What's up, guys? Just want to update you guys on my wisdom teeth extraction journey. It's been about 5 hours or so till I finished. He's saying I'm looking.
So all of this is within the first day, as he said. Only a couple of hours has passed, and he's doing all right. He's doing fine. Of course, the first few hours are the worst. I would argue even up to the first 24 hours, the first few days, there may be some difficulty.
Yellow.
Yeah, you look scary.
Baba, I look yellow. I think tomorrow and the next day will be painful, so I'm just gonna keep you guys along for the journey, and I'm gonna get some color back in me. Happy juice, but I just think that stay on edge, you know, like don't be afraid of what's gonna happen. Okay.
If I was on a walk and I saw you at a voice.
Trying to smile. Yeah, guys, so it's day 2 of wisdom teeth life. Well, no wisdom teeth life. At 3 a.m. last night,
So he transitioned from wisdom teeth life to wisdom teeth less or without wisdom teeth life, because he just lost all of his wisdom teeth. You can see some mild, I think he said day 2, right? So you can see some mild swelling. Now, then the like day 1, 2, 3, expect it's not like, oh, it gets dramatically better the first few days. No, in fact, some of the swelling and signs may increase a bit the first few days.
I feel like all the happy juice and numbness wore off, and it was so painful. Oh my gosh, I came down here, drank some milk. I haven't drank milk straight up in like, dude, a long time. Good thing is I can feel my lip again. The bad thing is I can feel my lip again.
Right, so that's what a lot of patients may describe, is that it's good that the sensation comes, as we discussed, once the anesthesia effect wears off. Great, but also not great, not so great at the same time, because if there's any pain or so forth, you're going to feel it as well.
Kind of a joke. I actually don't remember most of yesterday. To Starbucks. Cheers.
Cheers, babes.
Thank you, Haley. Thank you, Haley. I'm getting...
I have to.
So as you could see, looks like he's FaceTiming his dad or something, but the swelling, as I discussed, it may increase slightly the following days, and you can clearly see one side is quite swollen, a bit more than the other. The other is a bit swollen as well. I'm not a huge advocate of removing all 4 wisdom teeth at once. I may divide them into separate visits. Again, it's up to you and your dental or healthcare professional to consult with and see what's most suitable for you. Do you want just like, in and out, everything to be completed within one visit or not? That's all for today. Dr. Mo, the dentist, don't forget to leave a like, turn on the notification bell. Thank you everyone for watching.